So I wanted to go over briefly what is family history and why does family history matter. We'll talk about different types of colorectal cancer, and I hope to show you that family history matters in terms of the risk of disease, how we follow you, what we can do to prevent cancer, and also what it means for your family members. So just kind of a picture of a pedigree. You've probably all seen this. If you've ever talked with a genetic counselor, that's what they end up drawing after they've taught to you. So the key things that we always ask you is we hope to construct a tree that includes 3 generations. We ask you about your family origin. We want to know the cause and ages of death in your family members. If people died of cancer, we want to know what type of cancer and what age was the cancer diagnosed. So how does that help us? It helps us differentiate whether the cancer may be hereditary or whether people got the cancer because of lifestyle or environmental causes. It gives us a way to look at a pattern of how the disease is transmitted through the different generations, and it helps us identify future and potential risks. So it's not just a picture we draw, we actually can do something about it. And as the rest of the talk will show you, the family history does impact on screening, surveillance, and prevention. So the one message that I want you to take away is that your family, only you will know your family history. We can draw your blood and do a lab test and figure out what it is. So it starts with you, and we want you to know your family history because it matters to us. So just a second about colorectal cancer. You all know this remains the third most common, also the third most deadly cancer in the States. Over the past few decades, the mortality of colorectal cancer has actually decreased over time. We think the biggest contribution comes from screening. And when you look at colorectal cancer as a whole, we can divide it into 3 groups. The majority are what we call sporadic cancers, and these are what we think of cancer that just occur in patients. You know, we may say, hey, you just got it because you're unlucky type of thing. About 10% are what we consider to be familial, so these patients may have one relative or 2 that have colorectal cancer. And then about 5% are what we call hereditary. That means there's a particular gene that's mutated in those families, and that particular types of cancer can be passed on through generations. So why does family matter in terms of your disease risk? Many studies have been done, and this is just a study that was a prospective study where they followed, large numbers of men and women. These patients were followed over time, and we know that patients who have a family history of colorectal cancer are at increased risk for having colorectal cancer. So how high is the risk? If you have a first-degree relative with colorectal cancer, you're at about 1.7 times more likely to get a colorectal cancer as a general population. With increasing number of relatives affected and younger the age of the relative affected, the risk goes up. There does not seem to be a difference in terms of the location of the tumor, though. So that was kind of a very early on study done in 1994. Since then, there's been more and more studies, and this is kind of a summary table showing what we think of as the risks compared to the general population if you do have a family member with colorectal cancer. So just a word about the major hereditary syndromes. You'll hear more about that when Ms. Bannon talks, but basically it's grouped into 2 big groups. One are syndromes that cause people to have a lot of polyps, so we call those as polyposis syndromes. The other group are syndromes that don't cause a lot of polyps. So the most common of that is something called Lynch syndrome, and some of you may be familiar with that. For those hereditary diseases, when you look at these numbers, these are the risks of developing colorectal cancer by age. These numbers are significantly higher than the numbers I was showing you on the other table, because the other table refers to kind of general population risks, or just familial colorectal cancer where you have one first-degree relative. But these syndromes confer a very high risk for colorectal cancer to the patients at relatively younger ages. And in addition, there are also a whole cohort of other cancers that's outside of the colon that these patients are susceptible to. And these are just a partial list of them. And again, there will be more details discussed later this evening. So how does family history impact on surveillance and prevention? So when we talk about colorectal surveillance, we're talking about colonoscopy, but hopefully we've progressed since this picture. The guidelines are very complex, but basically it boils down to if for average risk general population, we recommend starting colonoscopy screening at age 50, and it will go on for every 7 to 10 years. For patients with a family history of polyps or cancer, we typically start at 10 years younger than the earliest incidence of cancer in the family, and the frequency is about every 5 years. And then for the 5% of the patients with hereditary syndromes, there are actually very specific guidelines, and the frequency is much more frequent. So does colonoscopy and screening help at all? This is a brand new study that was just published, I think a few weeks ago, actually. So this is a study where they followed patients who had undergone colonoscopy and polypectomy during colonoscopies, and this is after years. So if people had not had colonoscopy and polypectomies done, 25 deaths would be expected, but 12 deaths was actually observed. So this is one of the first studies to show that colonoscopy is actually reducing death rates in the States. In terms of if your family history is such that it puts you in the category of patients with a known hereditary syndrome, that obviously puts you at a much higher risk for getting cancer. And for those patients, we also have good evidence that screening reduces their death rates. So there's studies from Europe in patients with HMPCC and Lynch syndrome that show that when you look at patients who chose regular screening versus those that didn't, the death rates of the patients that got screened is much, much lower than the other group. So everyone wants to know what they can take to prevent cancer. And there's actually been, you'll hear more from our dietitian. There's a few studies out there, and there's actually very few agents with proven benefits. So for general population, the only thing that's really shown to work is aspirin. But I don't want you to all go home and start popping aspirin, but just realize that this is a mega dose of aspirin, much, much higher than what we normally take, and the difference is only shown after 25 years of follow-up. So the effect's actually very small. For patients with a history of adenoma or a previous cancer, a few agents have shown benefit, and they include aspirin, COX-2 inhibitors, and calcium. And then for the very specific group of high-risk patients, hereditary cancer patients, also aspirin and non-steroidal anti-inflammatory agents like Solindac, they've shown specific benefit in specific pockets of patients. So the other concept I'll mention briefly, because I'm a surgeon, is that the other thing that your family history may impact on ways to prevent cancer is the use of prophylactic surgery. And that's kind of so for the patients where we know the risk of developing cancer is super high, sometimes they have the option of us preemptively taking out the organ such that the cancer cannot happen. And this often happens in the setting of colorectal cancer in patients with a lot of polyps. So one example, this is an example showing patients with familial adenomatous polyposis, and that's patients who have developed tons of polyps in their colon, and where they face a very high risk of getting colorectal cancer, and there's been studies showing that the survival is much higher when we're able to take out the colon before cancer shows up. And the other example applies to Lynch patients or HMPCC patients, where women are at significantly higher risk of getting endometrial cancer, and we know that taking out uterus and ovaries after they're done with childbearing has an impact on the incidence of cancer. So lastly, just a word about why does your family history impact, how does your family history impact the family? So we know that overall in the United States, even though we know all the benefits of screening, it's hard to make everybody go and get a colonoscopy and get screened. The utilization rates are pretty low. It's got a wide range of 16 to 70%. When we look at the patients that have a known history of cancer, though, that rate's pretty high. At least over 50% of family members who know that they have a family member who's had colorectal cancer are willing to undergo screening. So it's important to, if you do have a diagnosis of cancer, it's important to kind of let your family and even the extended family know and kind of talk about screening strategies. So people who's never had a colonoscopy is definitely afraid of a colonoscopy, and the people who have had one and need one every year make it a part of their life. And so it's a hard topic to bring up at a family reunion, but it's something you can talk about. So just to quickly summarize, hopefully I've shown you knowing your family history will make a big difference in terms of knowing the risk of getting colorectal cancer and polyps, of us helping you devise a surveillance plan. It opens options for you for preventive strategies, and then it will impact you and your family members in terms of their risk. So I guess the message is to know, share, and actually act on your family history. And then again, because it starts with you, the onus is really on you to start the conversation in the family.